Hello everyone, it's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have 2 locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like lipofoams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye. Everyone, Ashley with Amare. So, I'm going to blow your minds. Are you ready for this? You're going to be like floored. Are you ready? If you don't get your manual lymphatic drainage, like till a month after surgery, you're not going to die and you're not going to ruin your results. And this whole like panic that you guys put yourself in, oh my God, I need my massages right now. Do you even know why you need your massages? Do you even understand why? Because if you did, you wouldn't be freaking out. All right. So after surgery, you're swollen, right? So day 1 and 2, you're like in pain and drugged or whatever. And then you're, under it, all the anesthesia still in your body. You're on all the Percocets, Oxys, painkillers. You're all like wonky, right? Like a zombie. And you should be mostly sleeping. So there's that. And then like by anywhere between day 3 to day 7, you're like swollen like a pumpkin and you start freaking out. You're like, oh my God, I am so swollen. Oh my God, this is so uncomfortable. I'm freaking out. What do I do? Oh my God. So you scramble and you find the first available person out there that does squeeze massage, which ding ding is illegal in lots of almost all the states. Definitely in New Jersey, definitely in New York, definitely in Florida, because I have state board rulings stating that it's illegal and, someone just got their license revoked for that. And definitely in California, it's illegal as well. So again, you go, you scramble, you're like freaking out. Guys, why are you freaking out? Like, what do you think it's going to do? Yes, it's going to help get the swelling down. Yes, it's going to make you feel better. Yes, it's going to help you heal. But why are you in such a panic for this? Who caused you this trauma that made you think that if you don't get like lymphatic massage immediately after surgery, you're going to like die? Like what, who did this? Who did this to you? Because I can tell you right now, they didn't know what they were doing. So let's backtrack a little bit here. How did this whole like massage thing start where you're like freaking out that you need your massages, right? Because you're on these Facebook groups, you're on the YouTube University, you're on the TikTok, you're following all these people who are getting squeeze massage immediately after surgery. That's fine. Now, granted, as stated in the high definition plastic surgery textbook for liposuction, it does say manual lymphatic drainage should be started 2 days pre-surgery, pre-op, and then every day consecutively for 2 weeks post-op. But again, that's an ideal situation. We live in a world where there's no access to real people like me. I'm in New Jersey and I'm the only one. Whereas in Miami, it's virtually non-existent. In other states, like with my virtuals, it's really hard to find an actual professional who knows what they're doing and isn't on the squeeze massage bandwagon doing all this illegal stuff, squeezing fluid out of you, has no idea about post-op care, like none of it, right? Not following their state scope of practice for massage and licensing. Like there's all those people out there, right? So this started because the squeeze massage people want you to come in ASAP, because they want to squeeze blood and fluid out of you, right? So if they wait too long, and as some of you have experienced, when you go in, they are really, really rough and they're squeezing the crap out of you and nothing's coming out, right? Because your body is healing. And you're still swollen, and they're not getting the swelling out. They're just hurting you and squeezing you, because that swelling is under your skin, in your lymphatic system, in your tissue, not meant to be pushed out through the body. So this whole thing started with these panic about the massages and needing them immediately. And oh my God, if I don't find somebody, I'm going to botch all my results. I'm going to be swollen forever. Okay, yes, if you don't take care of the swelling, it will stay there for years. Yes, I completely agree. But when you are still in super duper amounts of pain, when you're still healing, when you are still like a week post-op and can barely get to the bathroom by yourself, you should not be coming into my office to get treated for manual lymphatic drainage. Your body is under so much stress right now. Manual lymphatic drainage, what you should be getting after surgery, not squeeze massage, not puts stress, but the fluid dumps into your blood and goes through your heart, your liver, and your kidneys. So if you're already bogged down, if you're already tired, if you're already in pain, if you're already like really, really low energy and you're not feeling well because of the surgery, stay home and rest. That's the best course of action. Stay home and rest until you're coherent to hear what I have to say about your body and about your lymph system and about your surgery and all this information. Stay home until you're rested enough to get into my office. This is why I don't do in-homes. Because you guys, your body is not there yet. You're not ready to be processing all that fluid and running to the bathroom every hour on the hour, peeing it out. If you had a tummy tuck and it's a week out and you're still like not able to get to the bathroom by yourself at like a normal rate where you're comfortable and you're still like struggling, getting manual lymphatic drainage, any lymphatic work done right now is going to tax your body. It's a full body thing. It's not squeeze massage. We're not just squeezing blood out of you and, oh, okay, the rest of you is fine. Don't worry about the rest of your body. We're just going to take out all this fluid and blood. You're fine. Like, this doesn't affect you at all except the swelling. Actually, doesn't even affect the swelling because you still wind up swollen and in my office 3 months later. So, first part, it is better to wait until you are ready, until you are healthy enough, until you feel that you can get up and come into the office and you can move around to get your manual lymphatic drainage done. Now, second part of this video. You guys who are out in Miami, I get this question all the time, and I get it all the time in my virtuals. You say that you desperately needed massage while you were out there on day 3, so you let them do the squeeze massage. And it was the most painful thing ever, and you let them do it a bunch of days in a row, and you were cursing the lady out, and you were crying, and you were screaming bloody murder because it hurt so bad, but you kept doing it because you just needed to get the swelling out. Yet, you still wind up in my office with fibrosis and swelling the week you come back, which is usually like 2 weeks out. If you would have just waited while you were out there, stayed in your faja, drank your water, ate properly, greens, fruits, veggies, chicken if you eat chicken or protein and stuff like that, not had massive amounts of salt while you were out there eating chips and all kinds of other things. If you were taking your antibiotics and your meds the way you're supposed to, if you were using the products that I tell you to use, if you were in your garment 24/7 and resting until you came home, you would have felt better than getting the squeeze massage, being fibrotic, and coming home. Now, I do understand. A lot of you guys say that the squeeze massage while you're out there helps to get rid of the pressure and relieve the pain. I understand that. But the consequences of that is you having to pick up that same pain when you get home and still go through it. When you have fibrosis from squeeze massage, that hardening, that thickness, that numbness, you should never be numb after lipo. Never. You didn't cut nerves. You should not be numb after lipo. That is fibrosis sitting under your skin, desensitizing you, sitting on your nerves, and becoming scar tissue from the squeeze massage trauma. That is not normal to be numb like that. So yes, it may get you by until you come home, but guess what? Now you still have to deal with it in my office. And when that fibrosis starts reverting back to lymphatic fluid and starts, moving and dissolving, and we start getting that lymphatic fluid out, you feel the burning, the tenderness, the soreness, the pain, all the things you felt in Miami right before the squeeze massage, because your tissue's still healing under there, and it's still gonna happen. Whether you delay it with squeeze massage and have to pay me 10 times more to get rid of your fibrosis and be in your garment twice as long with all the lipofoams twice as long because you got squeeze massage while you were out there because you were panicking, or if you just stayed swollen, managed your pain, slept while you were out there, had lots of healthy foods, had green juice, had tons of water, were taking your meds the way you were supposed to, and came home and then dealt with the swelling. Yes, you'd have to deal with all of that healing up front, and then we clean up the body with the swelling afterwards. And that's it. And you're done. and you're healed. You don't have to go through this drama of, oh my God, I have fibrosis. Oh my God, my skin looks crazy. Oh my God, I don't know why I look like this. Why is this so hard? Why is this and this and this and this? Guys, stop, stop, stop. If you are traveling for your surgery and you do not have access to a proper manual lymphatic drainage therapist like myself, who's actually doing the right thing, water-style manual lymphatic drainage, dry hands on dry skin, gentle pumping motion to stretch the skin after surgery. If you do not have that, wait. Just wait. Again, that part of your healing is one part of your healing. It is not the whole thing. After surgery, you've got tissue that's healing, you've got blood stuff going on, you've got antibiotics, you've got check-ins with your doctor. Your body is healing, and then there's swelling. So the swelling happens because your body is healing. And as your body's healing, you have the swelling around it. Sure, is it uncomfortable? Hell yeah, it is. Does it hurt? Yeah, but you're in a faja. And you're doing, hopefully, the right things while you're out there. Just because you can't get your massages ASAP immediately, do not settle for squeeze massage. Do not think, oh, well, everyone on Facebook and everyone in these surgery groups and everyone on Real Stuff is saying, I need to get my massages immediately. So I'm going to get them right now. And I'm going to get whatever I could possibly get. I'm going to go to Massage Envy and get a Swedish massage because someone told me I needed massages after my surgery and I'm 2 days post-op. Oh my God, I have heard that. And it shocks the crap out of me because you guys are literally, not even squeeze massage, you're literally doing any kind of massage after surgery, having people touch your body. Or you walk in and they're like, yeah, I'm not going to touch you. You have something going on medically. No. Hopefully they would say that because it's not something they're equipped to handle. But again, this whole you guys are getting pressured into getting your massages without knowing why, and you're freaking out. And when I tell you that wait until you come home to find a good therapist if you can't find one out there wherever you are, or if you're at home, which is a client that I had recently, if you're at home and you're getting your surgery done in your hometown and there's no person within 15 miles of you that does this, the closest person is an hour away, you have two options. You can either pay for a hotel, bring all your stuff, stay out near that person for a week and get your massages done, but then when you come back home, you're still gonna have to travel back and forth if you don't stay out there for 2 weeks, if not a little bit more. Or you can just keep your happy self home on your painkillers in your faja, resting, drinking water, sleeping, and wait until you are well enough to get there. Wait until you're well enough for your body to handle that. Now, here's something else. You guys, during that time when you don't have someone, try to do the self-massage and all this stuff, this crazy stuff, right? Okay, don't touch your body. Do not play with an open wound. That's it. That is it. Everything under there, just because you can't see it, is technically an open wound. It's all healing. It's all been cut up. Everything has been, torn apart in there. So fat's been taken out. Things have been put back together. Things have been put in, implants, stuff like that. Do not play with an open wound. Just because you cannot see it does not mean that it's not an open wound trying to heal internally. Do not mess with it. I know, I understand. You hear your doctor tell you self-massage, but you don't know what that is. And when you guys go to do this, you're digging your fingers into your tissue because it's sore. And you think it's sore oh, I worked out, I'm sore. No. It's sore I cut my hand open. It hurts. That's what that's equivalent to. Just because it feels the same doesn't mean it is the same. So you guys are digging, and I see it all the time in my office. You're what is this? And you're digging your fingers into your body. And I'm guys, that's not even the lymph system. That's your bones. Stop it. That is your bones and your muscles. That is not, when you're feeling for fibrosis, it's just beneath the skin. Your skin feels thick. It feels like tree bark. It feels like Play-Doh. There's little balls under there. There's little bumps under there, and it's hard. You can just rub your hand over your skin and feel that. When you are digging your fingers into your body using pressure, stop touching yourself. Please just stop. Please stop. You're digging at your muscles and your bones. Please, Lord, stop. Stop. But again, lymphatic drainage, Manual lymphatic drainage. Lymphatic drainage work on the body, how the body drains the lymphatic system. It is extremely superficial. It is very little pressure, not really any at all. All I'm doing is laying my hand on and stretching the skin. That's it. I'm not pressing into the body. There's no downward pressure. When you guys are rubbing the crap out of yourselves, it's all downward pressure into your body. You're not trained. You have no idea what you're doing. You don't know where the lymphatic watersheds are. You don't know where the lymph nodes are. You don't know how to dilate them. You have no clue. So when you're doing this self-massage, you're digging into your body because you can't find someone, or someone's too far away, or you don't want to pay to go see someone to get this actually taken care of. And you're digging your thumbs and digging your fingers into tissue that's trying to heal, or is scabbing over in there, or has fibrosis, or whatever the case may be in there. So that's my thing on the self-massage. When, like I said, you're in your hometown and you're far away from someone or something like that and you can't get to them, whatever, making sure you have the right supplies. Guys, if you've looked into finding an MLD therapist, that is just one part of your healing. The rest of it is your supplies, your at-home care, your diet, your medications, what you're doing at home to take care of yourself. It's all that stuff. So that's what's more important in that first week than your massages are. And I tell you all the time, anytime anybody calls, they say, oh, well, when can I come in? I'm having my surgery. We usually say 48 hours after if it's lipo, if you are comfortable. If you cannot get up and drive to our office and get here comfortably, then it's too soon. Your body is not going to be okay with handling that fluid. Now, here's something else that I was told by the squeeze massage community. Manual lymphatic drainage isn't enough. You need body contouring, you need squeeze massage, you need incisional drainage for post-op care, because manual lymphatic drainage isn't enough. Okay, let me explain something to you. Manual lymphatic drainage was designed by Dr. Emil Vater for lymphedema and lipedema patients and cancer patients that has 60 pounds of fluid in their body from cancer or lymph node removal. You, after surgery, maybe have 5, maybe have 8, maybe a little bit more if you had a full mommy makeover. There is no way in hell you can sit here and tell me that I'm going to stab a lymphedema client with a needle and squeeze fluid out of her arm. That is blasphemy. And there's also no way in hell that you can tell me that manual lymphatic drainage isn't enough for post-surgery, because every single one of my clients over the past 7 years, with 8 sessions, maybe 12 if they're a really bad case, with 8 sessions of just MLD and proper supplies and proper at-home care and none of this other roller, ultrasound, cavitation, squeeze massage, wood therapy, body contouring, none of that. Just gentle hands on MLD, science, and at-home care, science has gotten them completely healed within a week, within 2 weeks, within 3 weeks, whatever the timeline is, without any of the other trash. I've helped clients that are 6 months out with fibrosis, that were doing cavitation, that were doing all these other things, still persisting with fibrosis, and we just do MLD, we just have them use the supplies that I recommend and teach them how to use for their specific case, and that's it. And fibrosis, gone. Healing, gone. Just like that, done. So, again, MLD, manual lymphatic drainage, was designed to get excessive amounts of fluid off of lymphedema patients and cancer patients. Yes, it is strong enough to do your post-surgery swelling. Yes, it is extremely effective enough to do that. But, again, it is a full body thing. It is not just getting your swelling off. It's your body reabsorbing the fluid and you pee it out. So you need to be okay with coming in. You need to be okay with drinking water. You need to be okay with getting up and moving around quite a bit so that you can get to the bathroom. So if you are struggling with this whole like, oh, there's nobody in my area, what do I do? Oh, I'm so worried because I'm not going to get my massages. When you come home from Miami, we can find you someone that is close to you. Maybe not as close as you'd like, but as close to you. Maybe they're an hour away. and we change your protocol and you don't go every single day. You go once a week, but we like go into hyperdrive with the at-home care. Maybe we find somebody that is super close and you do go every day, or you go again, still maybe 3 times a week instead. It depends case to case on the consistency of your fluid, on how much fibrosis you have, and on where you're at with your healing. Notice how I did not say when you had surgery, because that doesn't mean anything. You could have had surgery 9 months ago and still have massive amounts of fibrosis and loose skin and be swollen still. So notice how I didn't say that. It's not about the date that you had surgery. It's about where on the healing timeline you are with your body. So all those things have to be assessed to figure out how many of these we need, because after surgery, 48 hours, you are complete fluid. You are complete swollen. MLD will make you pee that out immediately and be the most effective immediately, because you have all of that swelling to reabsorb and pee out. If you are 3 months post-op with hella fibrosis, frozen all the way around, can't move, super painful, super sensitive, super tender, freaking out, blah, 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 doing MLD is going to help loosen the fluid and reabsorb the fluid around the fibrosis and whatever fluid is there. But it's not going to help soften the fibrosis and turn it back to fluid so you can pee it out. Yes, it helps get the fluid out from around it. Yes, it helps make the fibrosis a little more mobile and a little more soft. But the at-home care for fibrosis is what matters. Not body contouring, not wood therapy, not ultrasound, radio frequency, not any of that. I'm going to do a video next week on the science of fibrosis. But that whole fibrosis thing, I have many videos on it already. If you guys are on Spotify, hi. Come join us over on Instagram to find those videos. If it's also on the YouTube as well, the YouTube channel. But fibrosis is not where you just rub the crap out of it and it goes away. It's the beginnings of scar tissue. So that has to be reversed and broken down. And there are specific ways that we do that with the Amare lipofoam and your garment if it fits properly. So that's something that is different individually case to case. That's something that takes time individually case to case. We have to notify and figure out what your triggers are. I have to notify you and figure out what the reason the fibrosis got there is, how to get rid of it, what it looks like as far as getting rid of it, what you need to do. That's all person to person because it's not the same for everyone. Which is why a lot of people have a hard time pinning down what fibrosis is and where it comes from. But it's a huge thing in the lymphedema community. It's a huge thing in the lipedema community. It's a huge thing in these people who suffer with chronic lymphatic issues for their life. Their whole life they're in a garment. Their whole life they're having edema, which is swelling, and fibrosis, which is the hardening of swelling. So when it comes to your how many do I need and when should I start and what if I can't find someone, it may not be every day because you may not have fluid like that. It may be once a week. It may be once every other week. It depends on where your body is healing. So you scrambling immediately after surgery, freaking out because you can't find someone, not the best thing in the world for you. That manual lymphatic drainage directly after surgery, if you've had a tummy tuck with, or let's say you had a circumferential body lift with a BBL and a breast aug and lipo, bro, you are not stepping foot into my office until week 2. No way in hell are you getting in here. If you had a little bit of lipo, just a little bit, like just on your lower abdomen, just that little area. That's it. No flanks, no back, no sides, no upper abdomen, no arms, no legs, no chin, nothing. Just one section of lipo. Yeah, come in the next day. That's fine. You're going to be fine. You can get up, you can move around, you can get here, you can drive here. You're going to be fine to come in. But again, it depends. So you guys who are flipping out because you're like, I can't find anybody in my area. Oh my God, what do I do? What if I can't get there? What if I can't get my massages immediately? All of that panic was created with the squeeze massage. Manual lymphatic drainage therapists like myself will literally tell you to keep your happy ass home on the meds and drink your water and take your vitamins your antibiotics and your, painkillers and rest, because we know what the actual science is doing to the body. There is no rush to get in here. The swelling's not going anywhere. You're not going anywhere. I'm not going anywhere. When you are ready, when your body is ready, we can then deal with it. And guys, if you're traveling from Miami, you're going to be exhausted when you get home. Like, take a beat. Don't come in the same day. Take 2 days and come in after that once your body has settled to being back here. And again, I know tons of people who didn't get squeeze massage while they were out in Miami. And guess what? Their body didn't explode. They didn't. And they didn't have fibrosis at all. like at all. And it was 2 weeks, their first 2 weeks without any massage. So, that's kind of that whole thing. This whole like urgency to do it, it's from the money grab, it's from the recovery houses because they have you there and they want you to get the squeeze massage while you're there. It's from the squeeze massage people who see all that swelling in you and it's all liquid and it's getting pushed out of you, whereas if you waited there'd be nothing to push out because your body is healing. It's all of that community that created this. But if you follow the science and if you follow me and you listen to what I'm saying, none of that makes sense. None of that makes sense at all. That's kind of all I have to say about this. I just want you guys to stop freaking out when you call and we're like, we're not available for the next 2 days, like we're booked out, and you're like, well, I'm just gonna have to find somewhere else. Click. First of all, rude, hella rude, first of all. Second of all, you're gonna go and find someone to do squeeze massage, or there's gonna be no one available and you're gonna have to wait for the 2 days until we're available. But if you don't book today, you're not gonna get that spot in 2 days. It's gonna be another 2 days and you're gonna keep waiting. But yeah, again, stop freaking out. If you can't get in right away, if your body is not there yet, if you're forcing yourself, dragging yourself into my office because you're supposed to, why? Why are you supposed to? Do you know why? Do you know the science? Have you watched my videos? I'm Ashley with Amare. Do you know why? I'm explaining to you why. So again, guys, if you can't get them right out of the gate, if you have to wait 2 weeks, if you have to wait 3 weeks, I have people that get no massages because they didn't know they need them and come in after a month, and we still get their end result, and we still get the swelling off them, and we still get the fibrosis off of them. And they didn't get anything done at all for a month. So if you guys are properly planning ahead, properly plan ahead without freaking out that you're not going to get your manual lymphatic drainage massages directly after surgery. Because again, depending on your body and your surgery, that may not be the best course of action. So if you need help on figuring this out, as far as like, okay, where do I go? When do I get it done? What do I do? I've watched your videos. Like, I don't know what to do. I need help. Call the office, 732-841-0142, and Alex will set you up with a virtual, which is $90. This is literally what my virtuals are for, is to assess your body, your surgery, your health conditions, where you're having it done, where you're coming from, who's in your area that's going to do this, and if we should start sooner or later, and how many we should do, and when we should do them, and what you're doing at home, and the whole thing. So give our office a call, 732-841-0142. Alex will happily get you set up on my schedule with that. If you guys DM me and you're like, well, I'm doing this and I'm here and this is my surgery and that's what it is. How many do I need? I don't know you. I am not going to tell you anything, and I'm going to tell you to call Alex and set up a virtual. Or it's not even me. It's my girls who answer the messages. But they're going to tell you to call the office just like I did and set up a virtual. And then you're going to tell Alex, well, I'm doing this and I'm doing that and I'm doing this and this is my surgery and this is when and this is where. How many massages do I need? And she's going to tell you you're going to need to talk to Ashley. Because again, it's not just cookie cutter. It's not how it works. It's not just, okay, I'm getting lipo 360. This is when I should start. No. Because if you have health conditions, if you're anemic, if you are on iron transfusions, if something happens during the surgery, like there's all these different things, guys. You can't just slide in my DMs and expect me to give you an answer. I need to see who you are. I need to talk to you. I need to know what's going on. I'm not going to tell you a thing because I don't know a thing about what's going on. So, again, give the office a call. Thank you for listening, and please do not freak out if your only option is squeeze massage. Wait until there is a safer option. If you take anything away from this video, do not try and just get squeeze massage because there's no other option. The other option is wait until you find someone professional. That's it. Wait. It's not going to kill you to wait. It's not going to ruin your surgery to wait. It's not going to ruin any of your results to wait. There are people that wait months before they even realize this is the thing. We still get them results. Just wait. So, guys, that's it. Thank you. Have a good rest of your day.